My name is Owen McClung, sitting in with Helicopters Without Borders. I'm the CEO of Helicopters Without Borders. We're a non-profit, charity-based organization out of Vancouver, and we're in here at Ahousaht today with our mobile dental clinic. The mobile dental clinic is everything from x-ray machine, compressor units, sterilizers, so we can pretty much do everything that an individual would do in a dental clinic in a urban setting, may it be Tofino, Vancouver, but it's completely mobile and it's set up here in the CHR today, and it's going to be here till Thursday, and this is our first visit into Ahousaht with the dental clinic, so we're pretty excited.
Touch them high up and see what they got set up.
Yeah.
So this is the dental clinic.
Hi.
Hi
There.
Hello, you're the
Hi.
dentist.
I'm the dentist. This is
Okay.
Rosie.
Hi, Rosie.
Hi. Yeah, so this is our dental office. We came and it was in bins and bags, and we have everybody kind of pitching in, helping unload and getting everything set up, and it's a dental office in an empty room.
Okay.
So we have our chair here for the patient that's able to lay back, have them nice and comfortable. Just like that. And then we have our cart here that has all of the handpieces and things for doing fillings,
Fillings,
cleanings, root canals, you name it, extractions. So we can pretty much do all of that. And then we set up our sterilization area in the room next door.
And we have a handheld
Oh,
X-ray
yes.
here.
Yeah.
Wow.
So we're able to do x-rays.
So we do X-rays. It's a beautiful.
It looks
machine.
like a science fiction
Yeah,
X-ray gun.
Pretty much. Yeah. We've been doing this for a good number of years. I mean, this particular program, working with Helicopters Without Borders, doing fully mobile. It's really, this is our second year of doing it. Maybe 3 years in total we've been working with Helicopters Without Borders, but Rosie and myself and my company has been doing mobile servicing to remote First Nations communities for the last 12 years in British Columbia. So we fly in and we set up the clinic, and we just build it out in whatever space we have available. We need to have just a water source and plugs, and we can just start seeing patients right away. And then once we're finished up, we just pack it all back up, put it back in the helicopter, we're gone. Once we've got this this program up and running, we'll have an idea of what kind of community support we have for it, and what sort of timeline we can work on. So the goal with a community of this size would be that we would be coming every couple of months. So
Every couple of months.
yeah, for a week at a time.
For a week at a time.
Yeah,
And
exactly.
you could service about how many community members in that time, you think? Depending, I guess, on the work.
Usually about 35, averaging about 35 for the week that we could see, and all ages. So we see the little ones, if they're too young to have any work done, then we give them a ride in the chair. They get to pick a toy from the prize box. We work on elders, making sure that they're nice and comfortable, and providing all services to basically anybody that needs it.
This is your X-ray machine?
Yep.
Oh, okay.
Just had our test ones up there right now, so nobody's teeth or names or anything. So.
Okay, good.
Yeah.
And also the number of 35 is really for adult patients and teenage patients. If we're doing like kids programming, which we do in some communities, the numbers are much higher because our times it takes us to do the work isn't quite as much. So we could see, for a kids program, we could see 100 kids in a week.
Wow.
Yeah.
And getting them introduced to this
them
in a
introduced.
friendly
Exactly.
way and
Exactly.
in their own community.
It gives them
Yeah.
a safe place to come,
Yeah.
and it makes it something that they can do with their peers. So we usually bring them in a classroom at a time, or 4 to 5 kids at a time, so they can see each other in the chair, so that it's not scary. We check their teeth, we do a cleaning for them, we take x-rays, and they get to choose a prize, and that's their first visit to see us. So it keeps it really friendly, keeps it really comfortable for them, and it introduces everything that we're going to use in any future appointments without them being scared of anything, and having their friends there to experience it as well makes it more of a group effort, and so they really love it.
Thank you so much
Yeah,
for
thank you.
inviting
No
us into
problem.
your mobile dentist office here at Chuchum. They will be here until Thursday.
Thank you for your support.
Thanks for having us out. You know, massive benefits for the community themselves because we can do lots of things that you wouldn't be able to do if you're just going out for emergency treatment, you know, here and there, a couple of trips a year with limited numbers of patients, because we can do preventative programming with the kids, we can do kids programming, we can work with elders, do elder care. People that don't have the ability to travel out of the community can be seen, and overall for all of the people from kids to adults, they can have more of a preventative program aspect, which allows you to kind of head problems off before they start to become emergencies, right? Going out and putting out fires in city clinics only does so much. It doesn't really advance you. It only takes care of the issues at that moment. But when we're here in the community, we can look at things with a more holistic viewpoint, and that's really how you get yourself closer to wellness, which I think is our goal.
I'm really excited and I'm really happy that we have a dentist here in Ahousaht now, and it saves all the time traveling. Now we just travel down the hill and we can go right home after that, and instead of all the trouble to the hotel, motel, C-bus, the bus. Saves all that. It's a real good feeling to have them here.
Nice. And so tomorrow you said you got all your...
9 a.m. our whole family is, even the grandchildren, so it's a good thing.
Nice.
Yeah.
Here we go, happening until Thursday.
That's true to